Now, one more thing. You know, if you have abdominal hernia or groin hernia, usually you find a bulge there, abnormal bulge. But there is one hernia in this area which does not produce any bulge. Which does not produce any bulge, but produces severe pain on the medial side of the thigh, right? It can, and also patient will have, because loop of bowel or piece of bowel is in that herniating position, so there may be a patient who comes to you who has bowel obstruction, but you don't find any inguinal hernia, direct or indirect, no bulge of indirect inguinal hernia, no bulge of direct inguinal hernia, no bulge of femoral hernia, but there is bowel obstruction. With that, you are having pain where? Medial side of the thigh. What is it? You need to be student of Sherlock Holmes to find this diagnosis. This hernia is that, just come here, a piece of bowel or loop of bowel is herniating through the obturator canal, and as obturator canal is very narrow, if something extra try to go there, it compresses the nerve and artery and vein. So medial side of the thigh will have pain and severe ischemia. So listen today, it's rare condition, but maybe one of you becomes Sherlock Holmes doctor, right? One day you might be successful in diagnosing a rare condition which other doctors are unable to find. They will find but don't know what to do because they don't know what it is. So might be a person who has abdominal, what this? Gastrointestinal obstruction, and with that he is having medial side of the leg, what? Pain or tingling sensation. Probably, most probably, he or she is having obturator hernia. What is that? Obturator hernia. In this obturator hernia, this feature, pain and tingling on the medial side of the leg, is given a special name. This sign is called Howship-Romberg sign. Howship-Romberg sign. How is it? You got it? You got it through herniation through obturator canal, right?